Hi, this is Dr. A. In this medical terminology video, we're going to look at the signs and symptoms of the endocrine system. So we have adrenomegaly is an enlarged adrenal gland. Adrenopathy is a general term for adrenal gland disease. Edema is excessive fluid in body tissues. Endocrinopathy is a general term for disease involving the endocrine system. Exophthalmos is protruding eyeballs. It's a sign of excessive thyroid hormone or hyperthyroidism. Glycosuria is sugar in the urine. So this is exophthalmos. Don Knotts from the Andy Griffith Show is a pretty good representation of hyperthyroidism. Gynecomastia is the development of breast tissues in male. Hirsutism is an excessive amount of hair. It's a sign of a hormone imbalance. And this doesn't have to do with having nice, full, thick hair. It usually means having hair in places you normally shouldn't have or don't have hair. So for females, it might be, mustache and beard hair that are popping up. For even in guys, it might be excessive amount of hair on the body. And it often also, the hormone imbalance might cause like hair loss at the top, male, pattern baldness in males or females. Hypercalcemia is excessive calcium in the blood. It's a sign of hypersecretion of parathyroid hormone or potentially cancer. Hyperglycemia is excessive sugar in the blood. It is a sign of diabetes mellitus, so you would have high glucose levels. Hyperkalemia is excessive potassium in the blood. Remember, kali is from kalium, for the Latin word for potassium. Hypersecretion is an excessive hormone production by the endocrine gland. And I do want to put also in there, should be hypernatremia, should be in there. There would be high sodium levels. Hypocalcemia is insufficient calcium in the blood. It's a sign of insufficient parathyroid hormone. Hypoglycemia is an insufficient amount of sugar in the blood or low blood glucose. Hyponatremia is an insufficient amount of sodium in the blood. And it is more likely for somebody to have hyponatremia than hypernatremia, but it's worth mentioning both. Hyposecretion is an insufficient amount of hormone production by an endocrine gland. And obesity is having an abnormal amount of body fat. And then lastly, we have polydipsia, excessive feeling of thirst. And polyuria is producing an excessive amount of urine. Polydipsia and polyuria are both signs and symptoms of diabetes. A syndrome is a group of symptoms and signs that combine to present a clinical picture of a disease or a condition. Thyromegaly is an enlarged thyroid gland. All right, and so that wraps up our signs and symptoms of the endocrine system.